The one thing you need to decide before you actually buy your defibrillator is, do you want a semi-automatic or a fully automatic? Now, the difference between the two, a fully automatic AED doesn't have a button to push the shock. So what it'll do is it'll automatically do it. So once you activate it, it will tell you through all the process, you put the pads on, go through the analysing cycle, but then it will decide it needs a shock. Therefore, it will count down and it will deliver the shock without you pushing the button. Now, the advantage of this is it's simpler and easier to use. There's no hesitation, because sometimes we've found that people don't push the shock button because they're a bit worried or they're scared they might do something wrong, which is rubbish really, because the unit will just tell you it'll only shock if the person's in a shockable rhythm. So having a fully automatic one like this one means that you have less to worry about. You put it on and use it. Now, a semi-automatic one looks exactly the same, apart from you do have a shock button to push. So what that will do is, as it goes through the analysing cycle, it will say shock advised, and it will say something like push the flashing orange button. And then you can make sure everyone's clear and you push the button, it will deliver the shock. Now, the key thing with an automatic one is with the semi, you push the button, in which case you can look down at the patient and make sure no one's touching the patient and you're not touching the patient. With the fully automatic, you need to make sure you stand clear as soon as it goes through the analysing cycle, because you don't want to pick up your heart rhythm and say no shock advised. And also, when it delivers a shock, you don't want to have anything to possibly remove that shock onto you. So between the two units, they're very, very similar in what they look and feel like. However, it's just the fact that when you have a fully automatic, you do not have to push the shock button. It does it automatically for you.